According to Ghana's Demographic Health Survey, about 1 million babies are born every year, out of which about 30,000 die before 28 days. This newborn death accounts for nearly 40% of under 5 mortality in the country. However, health experts say 70% of the neonatal deaths are preventable through basic interventions both within health institutions and at the community level. As part of the effort to minimize the under 5 mortality rate in the Northern Regional Health Directorate has organized a 2-week training program for over 300 health personnel in the delivery and the management of newborns at the various district hospitals and community health centers. Newborn care training, which is sponsored by UNICEF, is aimed at ensuring health workers have the requisite skills to spot danger signals during delivery, after delivery to provide appropriate care at the most vulnerable periods in a baby's life. In an interview with Vasa One News, the Deputy Director for Clinical Care, Dr. James Sarkodie, noted that there is a need to empower the community volunteers and caregivers in the early detection of complications.
Is that we must empower both the mother and the caregivers and the volunteers within the community, so that they should be able to identify basic signs and complications in newborn cares and then initiate treatment and refer to the next level of care for treatment to be done. Having said that, we also want to initiate the support from the community level so that they know the complications that can occur at the community level. We go over there, support them, and then others who see the benefit of that, when they get similar complications, will bring them to the health centers.
A pediatrician at the Tamale Teaching Hospital, Dr. Alhassan Abdul Mumin, called for integrated management of both the mother and the baby in a bid to minimize the level of complication that may arise in delivery or after delivery at the health centers.
Most of the problems that you actually have in the newborn baby especially are problems that are due to problems that would have occurred during pregnancy and immediately after birth. Okay, so if you handle the mother separately and then you handle the baby separately, there are so many of these issues that you will overlook, and that ones will lead to death. So it's so crucial that people who work with pregnant women also know how to handle babies when they come out. So you just don't deal with the mother, but you deal with the product that comes out of the mother, such that you know very well that this mother that you are dealing with actually may deliver a baby. The pregnant woman that you are dealing with may deliver a baby that has problems, and you should know how to handle the problem when it comes. So it's so important that we integrate both the mother and the newborn care.
Dr. Sarkodie further noted that there would be a refresher course for 128 community volunteers in the coming weeks, who will also train other volunteers on newborn care. Luanash for Vasa One News.